Next question, the member for Carleton.
Thank you, Mr. Speaker. My question is for the Minister of Children, Community and Social Services. According to an Institute for Clinical and Evaluative Sciences report, suicide rates in Northern Ontario were 6 times higher than the provincial average, whereas Southern Ontario was comparable to the provincial average. Furthermore, suicide rates in Canada are 5 to 7 times higher for First Nations youth than for non-Indigenous youth. Today, the Chief Coroner of Ontario's expert panel report on residential housing deaths was released. The safety and security of children is of the utmost importance to us all. Could the minister tell this House what steps are being taken to ensure incidents like this are never repeated?
Minister of Children, Community and Social Services.
Thank you very much, Speaker. I want to thank the member from Carleton for her advocacy on suicide prevention and for her compassion here today. I'd like to thank the Office of the Chief Coroner of Ontario and the expert panel for putting out this report and the recommendations. The experience of the children outlined in this report are heartbreaking. The death of a child, particularly in care, is unacceptable. My heart goes out to the families, the loved ones, and communities affected by these tragedies. The deaths are unacceptable, and I'm going to take immediate action. We need to do more to make sure children are safe and cared for. If a child dies, someone is responsible. We must improve coordination among service providers, as well as throughout our ministries. I'm currently engaging with the Ontario Child Advocate, the coroner, Indigenous community leaders, as well as the LGBTQ leaders. From the CASs to group homes to my ministry, we all bear some responsibility. And I want to ensure the House, that is the new minister, the buck stops with me, and I will take action.
Thank you. Supplementary.
Through you, Mr. Speaker. Thank you, Minister. I understand that mental health services available to children in care are often limited or ineffective. Through you, Mr. Speaker, can the minister please clarify what steps are being taken to give our most vulnerable more support when they need it the most?
Minister.
Thank you very much. The experiences of the young people described in this report were very difficult for me to read, and it was a very difficult briefing from the coroner last week. Our government will take action to bring systemic changes to the residential services system. Together with partners from the child welfare sector, Indigenous communities, LGBTQ2S partners, and the Ministers of Health, Education and Indigenous Affairs, we will take a collective approach to help residential placements and coordination between government agencies. So let me be perfectly clear. I am going to take immediate action to put in place better screening protocols for youth who are at risk and who need help. I'll issue a directive to the Ministry of Children, Community and Social Services, CASs and group homes to put the child first. It's not about checklists, it's about taking responsibilities for a child's well-being. And we're going to continue to improve inspections to lay out clear lines of responsibility and ensure supports are in place. And finally, we'll support youth and their workers to access mental health services and resources when and where they are needed. But let me be perfectly clear, this government for the people will put children in care first. Thank you.